Britain has been heavily hit by a vicious bout of Aussie flu and is now spreading in Europe. What is Aussie flu? What are the symptoms of the killer bug and how is it different from the normal influenza virus? This is a brutal flu strain has hit the UK from Australia, leaving Brits facing the worst flu season in 50 years. But what exactly is Aussie flu, and how is it different from the normal winter bug? Here's what we know. Aussie flu is a potentially deadly strain of the winter bug. There is no cure and vaccinations are said to be ineffective. Please try and avoid getting an infection by not going to town centres, travel in a crowded bus, train and visiting hospitals or surgery. Stay away from doctors, nurses and hospital staff because they may be carrying the viruses on their cloth and equipment. Symptoms of Aussie flu are similar to those caused by normal flu, but they are more severe. Here are some signs to look out for: sore throat and cough, headache, high or very high fever, body ache, muscle ache, tiredness, fatigue, runny nose and sneezing. People should recover from normal flu within a week so, although a cough and fatigue may last longer. If you're still really ill after 7 days, it's a good indication of something more serious. If you develop breathlessness, feeling hot and cold and struggling to breathe, going blue or you are delirious, please consult a doctor or go to the hospital. These are signs that can lead to pneumonia or secondary infection. Those most at risk are the over 65s, pregnant women, young kids and those with chronic conditions like diabetes, lung and heart disease. The strain of flu is called H3N2. The number of flu deaths in Australia over their winter has doubled. Some 4.5 million people and 1 in 4 hospital cases of flu are thought to be patients battling the Aussie strain. In UK, a surge in infections has seen cases of the new H3N2 strain skyrocket since Christmas. 1,649 people had been struck down with Aussie flu over the Christmas week in UK. This is said to be the most serious flu epidemic since the 1968 pandemic that started in Hong Kong that killed 1 million people worldwide. H3N2 is a mutated strain of flu, meaning the vaccine in Australia has been less effective than hoped. Acute respiratory distress syndrome caused because the wall of air sac is thickened by flu and so reduce absorption of oxygen. If you don't recover after a week, it could be a sign that you know a more serious strain of flu.